I'm Sarah Parker.
I'm Laura McCoy. I'm Taylor Weekly.
And I'm Laura Brooks.
Okay, so we have Miss Simone Gerrand here. She's come in by ambulance. She's a 35-year-old female who has a compound fracture of her left femur. The ambulance officers have reported a significant amount of blood loss, so the first thing that we would do is put pressure on her leg. Okay, so we'll go through the ABCDE criteria.
Okay, so we assume cervical spine injury, so we've got the cervical spine immobilisation collar in situ. We're checking the airway, opening the mouth, checking for any material or the like vomit or the tongue blocking the airway. If it was, we use a finger sweep to unblock the airway. If there's any fluid blocking the airway, we can use a log roll with 4 or more people. One person immobilising the patient's neck to roll the patient over, so gravity will assist removing the fluid, and then we'd also use suction to remove the fluid, so we have the patent airway.
For breathing, her SATs are 26 and her oxygen her RESPs are 26 and her saturation is 94. So the first thing we would do is apply oxygen at 8 litres and then
O2 8 litres.
Yep. And then I would look at the bilateral rise and fall of the lungs and ensure that both of them are rising and falling to check for a deflated lung. I'd listen to both sides of the chest to make sure they sound the same. And check for excessive accessory muscles.
Yeah.
So for circulation, we're going to take all her clothes off. We're just going to cut down just to check that her the perfusion throughout the body. We're also going to check her capillary refill down in both feet, just to check that the blood flow is still going down, and they need to both bounce back in 3 seconds, which they are.
Yeah.
And we're still applying pressure to the fracture, just so she doesn't keep losing too much blood. We're also going to administer some fluids to get the blood pressure back up, as it's quite low.
So that's also part of exposure, so we're assessing the full the body of the patient when we've cut the clothes off. She's got a temp of 35.5, so we're going to pop some warm blankets on her, and we could also use humidified oxygen, and if she could tolerate fluids, give her some warm fluids for that, to bring that temp up.
Okay, so we would also check the colour, warmth, movement and sensation in the bottom of her leg, also checking her conscious state as well, seeing if she's conscious, alert, responding to verbal or painful stimuli, and we would also document everything every 10-minute. So
So we've got an order here for the doctor for fentanyl 25 microgram IV. We know that fentanyl is a potent analgesic. It works on the muscle receptors in the brain, the spinal cord and smooth muscle. Adverse reactions can include bradycardia and skin reactions, and also if it's given with droperidol, it can cause hypertension, which is going to be a problem with this patient. 25 micrograms is quite a small dose, so we can check to see what's been given by the paramedics on the way to ED, and we can also, it also might be, it's given as a pre-surgery medication sometimes, so that might be why it was ordered. So first we're going to look up fentanyl in the injectable handbook. So it comes in 100 microgram and 500 microgram vials. It can be given intravenously and over 1 to 2 minutes. I was just thinking, so we need to get the drug. Alright, so we've got our fentanyl 100 microgram in 2 ml, and we need to draw up 0.5 mils into the 25 microgram bolus injection. So we're going to draw up 10 ml of normal saline. We've got here. Can you grab me a 10 ml syringe? Yeah, thanks. Can you stop us? Okay, so we're going to draw up 0.5 ml of fentanyl.
And 10 ml of normal saline for flushing the cannula.
So we've got 0.5 ml of fentanyl there.
And I'm here to do the check as well before we give it. So the patient's name is Simone Jaron, and I'm going to check her UR number and all the details against the drug order. The UR is 861498, 861498. Date of birth 16th of the 10th, 77, 16th of the 10th, 77. She has no allergies. We have 5 ml of normal saline to check that the cannula is working. And this has been cleaned. And the end of this is sterile.
So it's flush, keeps working.
So the saline's going in and it's not tissuing. So the line's patent and ready to use.
Yeah, so it's already been swabbed, so we're just going to pop the fentanyl in, and this is pushed over 1 to 2 minutes. Slow push over 1 to 2 minutes, which we don't have time to do now, and then we'll flush,
And we'll just flush again so that there's none left in the line.
and then in sharps.
Okay, gel fusion.
Yeah, and then so document.
Document. Yep.
6 slides.
Sorry, just starting even. So we've administered the fentanyl, and now I'm going to document the time it was given and who it was given by, and the 2 nurses, Division 1 nurses that checked it. So the time is 13:30, and my initial and Sarah's initial.
So we have an order here from the doctor for Gelaffusion 500 ml, which is to go over a 10-minute period. Gelaffusion would be given because it's a plasma volume expander. She's lost a lot of blood, so that would be why. And we just, while it's giving, we just look out for signs of anaphylactic reaction. Yeah. Okay. So we've got Gelaffusion 500 ml. Yep. At the date, which is the 15th, at 10:30.
Yep.
And it expires August 14. And we've got the doctor's signature here. Yep. So we'll just check that against our patient. So we've got Simone Jones. Yep. UR number is 861498. Yep. And her date of birth is the 16th of the 10th, 1977. Yep, correct. Okay, so we just set it up. Push this in there. Would you like to swab for me? Connect it up. Then we basically just hold it up, put it on a pole, unclamp the roller, and push it through. And then that'll go over a 10-minute period. Yep. Okay. When that's done, we just clamp it off. And then we come over, we're going to go time given, and we'll initial it. Yep, and I'll double check that. So